Because my purpose and passion is to help people like yourself, I invite you to get comfortable, tune out the rest of the world, and follow me to a place that may change your life and the lives of others around you. I'm Dr. J. Sordean, and I invite you to take the natural pathway to optimal health. Your optimal wellness and vitality is something that I take very seriously, and so should you. Do you ever wake up feeling just like your energy's not quite right? Or do you ever feel like your health is drifting downwards? Well, that is a reason why you might call the doctor. However, I would like to offer some alternatives to that so that your health and vitality is much more dependable, powerful, and steady. There are small things that you could change in your lifestyle that could have huge benefits. So I want you to feel really great, because great is what life is all about. I began my training in 1971 when I was the surgical assistant for my uncle in Indianapolis. I began getting interested in Oriental medicine when I started studying Tai Chi Chuan and Japanese language at college. The focus of this video is on you and your health. As I share my knowledge with you, I'm sure you will agree and understand more about your body and how your health works. With this knowledge, you will be able to have a greater control over how you live your life naturally. Welcome to the class. I want to thank all of you for coming today. And how many of you have some experience with peripheral neuropathy? Raise your hands, please. All right. Thank you. So it's at least 80% of the people here, and I know a few people had also mentioned that they were here for a spouse or a loved one. And how many of you have goals in life you'd still like to accomplish? Raise your hands. How many of you would like to have more fun in life? That sound good? Or perhaps you'd like to have stronger and deeper relationships with people that you love in your life? Yes? And perhaps you'd like to know a little bit more about peripheral neuropathy, have more information on how some of the things you can do personally to help with the issue and other things that are out there. Anyone here for that purpose? Of course you are. That's what this lecture is about. So I'd like to briefly introduce myself. My name is Dr. J. Sordean. I'm an acupuncturist and herbalist in California. And I've been in practice as a wellness consultant for more than 30 years. People come from me not only just from this community, from all around the world. So I sit down and I go through in a very thorough manner to figure out what is going on with the individual so that we can help them best, often after many years of suffering. So today we're going to be speaking about peripheral neuropathy. And for those who, as people come in, I will be making sure that they also get the survey and the brochure. So thank you. Now up here, no, you may not be able to see the PowerPoint very well, but I first began doing work in natural medicine, Oriental medicine, back in 1971 when I started studying Tai Chi and Japanese. Anyone here speak Japanese? Skosh?
Ohayo gozaimasu.
Ah, very good. Ohayo gozaimasu, that's good morning. And so, or how about any of you do Tai Chi or Qigong? Raise your hands. Great. Years ago and currently, that's fantastic. Those practices can be very helpful for circulation, and that is partly what we need to address with the issue of peripheral neuropathy. So I started doing Tai Chi in Japanese many years ago, and When I was very young, my uncle told me, "You are going to be a doctor." And so he was a surgeon, and when I was 18, I worked with him as a surgical assistant. This was in Indianapolis, 1971, and so I assisted in about 54 surgeries. And those were big open wounds, you know, where you make a big cut. And nowadays there's a little scope and you have like a couple little scars. Anyone have those little scars on them? We aren't recording this, so it's all confidential. No one has any of those little scars? All right. So we did a wide variety of things. We did surgeries of cancer. We did surgeries of hernia repairs, varicose veins, vasectomies, mastectomies, etc. No brain surgery. But eventually my uncle developed diabetes. And he was in a nursing home, and because of the diabetes, gradually he was losing feeling and sensation in his legs, and they got infected. So one had to be amputated. And then the next one had to be amputated, and eventually he did die because of all the complications of diabetes. Now, as many of you may know, diabetes is one of the primary, it's 30% of the people with peripheral neuropathy have diabetes. So it's a major cause of diabetes. And in my own family, I have seen that happen. Now, many years ago, I was not trained in natural medicine, acupuncture, and the other techniques that I do now. So unfortunately, I didn't have a chance to actually help them. And they are living in Indiana, but and some people are kind of resistant to newfangled ideas. But so I couldn't help them, but it's my purpose in life to help as many people as possible achieve maximal health and vitality using as much natural methods as possible, so you can avoid unnecessary drugs and avoid unnecessary surgery. So I appreciate that people here with the neuropathy, at some point, if it gets bad enough, people end up having surgery. And I'm sure, how many people would like to avoid surgery if at all possible? I'll raise both my hands. All right, so what is peripheral neuropathy? Well, it describes damage to the nervous system outside the spine and the brain. The spine and the brain are what are called the central nervous system. And this is just going to do some basic review of anatomy here, so everyone understands exactly what we're talking about.
Thank you.
You might want to sit back here so you can actually see what's going on up here.
Oh, I have hearing problem.
Oh, all right. Am I speaking loud enough for everyone?
Yes.
Anyone can't hear me? No? When I was little, my grandparents lived next door to me. We had a big acre lot, and they were on an acre lot. And my grandfather used to complain that he could hear me playing next door. So hopefully I don't have a problem of projecting and filling this room. So peripheral nerves bring messages from the arms and the legs, and they also send sensory information back to the brain and the spinal cord. So it goes from the brain out to the fingertips and the toes, and the sensory nerves also bring them back to the brain so that we can sense whether something is cold, whether something is burned, whether we're actually putting pressure on our feet, where our body is in space. So those are some of the sensory nerves which are part of the peripheral nerves. Now, anyone have a telephone? Old telephone? Old telephone line? Well, you know, like static on a telephone line or on your cell phone, you know. Although the old telephones actually had a line, and this is much more similar to our nerves than a cell phone. Most people don't have a Wi-Fi system in their body for the nerves. But so like static on a telephone line, when there's peripheral neuropathy, neuropathy is damage to the nerve. Pathy means an illness or a disease. The message between the brain and the rest of the body becomes distorted or interrupted. And because every peripheral nerve has a very specialized function, in a particular part of the body, a wide array of symptoms can occur when nerves are damaged. Because there are so many different kinds of nerves, different kinds of symptoms can occur. Now, some people may experience a temporary numbness, or a tingling or prickling sensation. That's also called paresthesia, or sensitivity to touch or muscle weakness. Anyone here have any of those experience? Raise your hands, please, if you have. Thank you. I'm sorry to hear that. but these are examples of symptoms of peripheral neuropathy. Now, other people may suffer more severe symptoms, and those could include a burning pain, and that's often at night. Muscle wasting, that's where the muscle is getting smaller and smaller because the nerve isn't sending an impulse to keep the muscle growing or staying static. So you can have what's called atrophy. And so that's muscle wasting. One could also have paralysis or organ and gland dysfunction as a result of peripheral neuropathy. Sounds pretty bad, huh? So as a result of it also, people may actually become unable to digest food because the peripheral nerves also go to the organs. You might not be able to maintain a safe level of blood pressure. You might not be able to sweat normally. And you might not experience normal sexual function because the peripheral nerves all feed those particular organs and functions. And in the most extreme cases, breathing may become difficult or organ failure may occur because of peripheral neuropathy. This is what can happen as things degenerate and they aren't taken care of early on. So in the most common forms of neuropathy, the nerve fibers, now nerve fibers are individual cells that make up the nerves. These nerve fibers, most distant from the brain and the spinal cord, malfunction first. So first is where we start getting these symptoms. You can see here on this chart, it's on the feet, we've got the knees, we've got the hips. And so usually it starts at the feet and it works its way closer to the center of the body. That's why it's called peripheral neuropathy, farther away from the center. Pain and other symptoms often appear symmetrically, meaning both sides equally. For example, in both feet, followed by a gradual progression up both legs. This is the most common form of neuropathy. Next, the fingers, hands, and arms become affected. And the symptoms can progress into the central part of the body as well. And that's where the organs are. So many people with diabetic neuropathy experience this pattern. Anyone here either have diabetes or know someone who has diabetes? Raise your hand. Surely everyone knows somebody with diabetes. I don't see your hands up, but most everyone knows at least one person with diabetes because it is an extremely common problem in this country, partly because of the obesity epidemic.
What's the correlation between glucose control and neuropathy?
I'll get to that. Next, the fingers and arms become affected. Symptoms can progress in the central part of the body. I'm sorry, I can't ask, what?
Neuropathy, would it cause other, circulation and numbness and all that?
Yeah, that's what I'm describing right here. Yeah, it does cause circulation issues, but it also causes numbness because the nerves are damaged.
And people fall because...
People can have a loss of balance partly because they can't feel where they are, as well as the peripheral nerves aren't working right. Symptoms are related to the type of affected nerve and may be seen over a period of days, weeks, or even years. So this can progress over time. Muscle weakness is the most common symptom of motor nerve damage. So we have sensory nerves. Those are the nerves that sense different things in the environment. Hot or cold. Light touch, like have you ever been to the doctor and they take like a cotton ball and rub it on your body? You ever had that? That's light touch. And if you press harder, those are different sensory nerves. Those are heavy pressure. And then there's also, perhaps you've been to a doctor and they took a little needle and started going around like that. That's pinprick. So we have all these different kinds of sensory nerves, and each different type could be affected. Now we're talking about motor nerves. Motor nerves are the nerves that go from the brain out to the muscles. That's why it's called motor. That's how we move, is the motor nerves. So muscle weakness is the most common symptom of motor nerve damage. Other symptoms may include painful cramps and fasciculation. Now that's an uncontrolled muscle twitching, which you can see under the skin. Muscle loss, again, this is the muscle decreasing in its size. Bone degeneration and changes in the skin, hair, and nails.